Mother's Day. So today I'm going to talk about hormones and relationships. Either if you're struggling yourself with relationship with others, or you've got a relation or friend or family member or work colleague who you're not quite sure how to approach the conversation of hormones with to them. So menopause, perimenopause, PMS, PMDD, I've mentioned before, are all hormonal conditions, and our hormones work all around our body, not just from our ovaries. It's not just about our periods. It's not just about fertility. As many of you hopefully have heard before, that actually our hormones, estrogen, progesterone, testosterone, are produced in our brains as well. So whether we have ovaries or not, we will still be producing hormones in our brains, but those hormone levels can fluctuate and can decline. And we also have hormones, receptors for every single cell all over our body. So when I was thinking about what do I talk about for this Instagram Live, and thinking about relationships, the first thing actually that comes to mind is actually mood more than anything else. So I will talk a bit about physical relationship, but actually there's no point having any relationship if you don't feel firstly good in yourself, because feeling good in yourself is something that will enable relationships to be much easier. So whether that's just because you're talking to a friend, or you're talking to someone at work, or you're talking to your children or your partner, a lot of love and empathy comes from within. And one of the first things I learned when I was learning about consultations as a GP was that you pick up other people's emotions very quickly. So for example, if I'm with a patient and at the end of the consultation I'm feeling quite nervous or quite sad, it's taken me many years actually to realise I'm picking up from that person's emotions, rather than I really do feel nervous or sad. That person in front of me has sort of transmitted their emotions, if you like. And we all know that, don't we? If we're with someone who's happy and positive, we're going to feel happier and positive. Whereas if we're with someone who's very, woe is me, very down, it brings, it's like Eeyore, isn't it? That cloud over you. So when we're thinking about how does the menopause affect us, or the perimenopause? Well, many women report of having low mood, anxiety, feeling irritable, feeling short-tempered, not being able to sleep well, having low self-esteem, feelings of low self-worth as well. And all of these symptoms can be very common during the perimenopause and menopause. Now, if you're feeling like that, of course it's going to affect your relationship. I know when I was perimenopausal, I was really short-tempered. Not all the time, but sometimes I just felt that everything was too much, and little things that wouldn't have bothered me, like somebody's glass on the side on a table when we're eating. If it hit the table and I hear that noise or cutlery on the table, or it just was really frustrating. Or if someone clenched their teeth, that noise really went through me. I've said to people before, sometimes even the way my husband was breathing was really frustrating. And sometimes you just feel like, some people say to me, it's like a volcano just exploding. And it's almost, it's a weird thing for many people, myself included. I felt like I was almost had permission to be really cross, really short-tempered, really irritable, really angry. And once I started to get cross, I didn't really know how to control myself, and it was almost like I was entitled to feel so awful and be so awful to other people. And then other times I would think, why was I like that? Why did it bother me so much that no one had emptied the dishwasher, or that the washing machine needed filling up again, or whatever? Normally things just let me go, and it wasn't. So that is absolutely going to affect people's relationships. And then obviously there are other physical symptoms that can occur that can really affect us. So if we find, which many people do, that they put on weight, they've got muscle or joint pains, they physically feel different, maybe their hairs become drier, become coarser, become thinner, the skin complexion can be quite sallow sometimes, and just looking in the mirror, I remember at times I would look in the mirror and say to my husband, you know what, I just look awful. And he'd say, yeah, you do actually. And it would be horrible. And I thought, well, is it because I'm not sleeping well? Am I, what else has happened? Am I using different skin products? What's going on? And obviously the skin is a window to inside how you are. It's just another organ. But if your skin is not looking great, your organs probably aren't either. And there's this sort of perpetual cycle that if you don't feel great, you don't look after yourself as well, you might not eat as well. Many people tell me that they smoke more or drink more. And all these things make this sort of, someone called it a while ago, this spiral of doom. Once you start, it can be really difficult to pick yourself back up. And what you really need when you're feeling like this is someone to really love you and look after you and say, it's going to be all right. I think it might be related to your hormones. Have you downloaded Balance app? Have you read this book? Should we just talk about how you're feeling? And have you thought about ways that you might be able to get help or treatment? And I've heard that there are treatment options. Or can I just cook you a meal? Or can I just sit down and relax and I'm going to empty the dishwasher, or I'm going to put the washing on, or I'll put the children to bed. Really little things like that can be really, really important when you're experiencing perimenopausal or menopausal symptoms, or it's the days before your periods and you've got PMS or PMDD. So understanding that sometimes these symptoms can be transient, they can last longer, they can just come out of nowhere, is really important just to acknowledge. And obviously for me as a clinician, as a doctor, the most important thing when people are experiencing symptoms is to get the right treatment that's available for them. And as I've said many times before, the symptoms are a result of changing and lowering hormone levels. So having hormones back by having the right dose and type of hormones, often estrogen, progesterone and testosterone, can make a huge difference. But it can take a little while before people find the right dose and type for them. So while they're still experiencing symptoms, it's crucial to talk to those around you. So if you are fortunate and know that the symptoms are due to your changing hormones or low hormone levels, the first thing I think is really important is to talk to others. So actually talk to your loved ones, talk to your friends, talk to your colleagues and say, I just need to explain to you that I'm having a difficult time. I'm perimenopausal or menopausal, and there are times that my mood is really affected, and do not take it personally and please bear with me. And it allows people time to know what's going on and actually give more sympathy as well. None of us want to be having a sob story. We don't want, I hate it when people give me attention when I don't really want it, or I don't want people to feel sorry for me. But actually to acknowledge and know what's going on is really, really important. The other thing is that sometimes we don't know it's happening to us. And so I know myself, I had a few months of feeling this uncontrollable rage, feeling very low in myself, feeling very anxious, having feelings of low self-worth and reduced self-esteem. And I put it down to stress of the job, stress of having 3 children, stress of everything else that was going on. And what it would have been amazing in hindsight if my husband, who I obviously love and have been with for many, many years, he's known me since I was 18, I would have loved him to have sat me down and said, Louise, I wonder, you're 45 now. Do you think any of the way you're changing could be related to your hormones? But he didn't, because despite him being a doctor, he didn't know much about the perimenopause then either. And sometimes it takes someone away from yourself to notice that there's a difference, there's a change. And what happens sometimes, especially in a close relationship, so if you're married or you've got a partner, sometimes that partner internalizes things and thinks it's their problem and it's them that is the reason why you're being so cross or irritable. And often it compounds things. Whereas actually what you want is someone to be more objective and just acknowledge that it could be related to your hormones or ask questions. Now, for those of you who are the partners rather than the person experiencing, you think, how do I bring it up in conversation? Because if someone's shouting your head off and telling you off that your breathing's noisy, might be the last thing they want to hear is, do you think you're menopausal? Because then that's almost like blaming hormones and trivialising. So I think more and more, and I often advise people to say, do you think any of your mood changes or physical changes or whatever is going on, do you think any of these changes could be related to your changing hormone levels? Because I've been reading and I didn't realise how important hormones are in the brain, for example, and many women experience these similar symptoms, and wording it in a very sensitive way can actually be really helpful for people. And a lot of people say that they really needed their work colleague or their best friend or their mother or their relative or even their child to actually say something. And I'm sure many of you might have heard the story that it wasn't until she's now 19, but she was 11, 12 at the time. My middle daughter Sophie, had said to me in the kitchen, "Mummy, you're really, really irritable at the moment, and I'm just wondering whether you need your period, because some of my friends get a bit moody before their periods." And it was honestly the best thing I think she's probably ever said to me, because it was that light bulb moment where I suddenly stopped what I was doing and thought, do you know what? She's right. But actually, I haven't had a period for months, but I hadn't realised because I didn't monitor them. The Balance app wasn't there then. I didn't track my periods. And it was then that I thought, oh my goodness me, she's absolutely right. This is related to my hormones. Now, she wasn't even thinking about perimenopause. She didn't know that was a thing then. And actually, when I said to her, "Sophie, I think I'm perimenopausal," she heard the word menopause and said, "Oh, Mummy, that makes you feel really old. Don't say menopause." And actually, it's not an old person's thing. I've already said before, many women are in their teens, 20s and 30s who will become menopausal. But the most important thing is for others to help us make the diagnosis, because two things: there's less suffering if we get the right treatment, because the sooner we have hormones back or know what's going on, we can get the right treatment for us. But also we know there are health risks when we don't have hormones. And so acknowledging that we've got this increased risk of heart disease, osteoporosis, diabetes, dementia, we can look at our lifestyle, we can address whether we want hormones, and if we do, the sooner we take them, the better. So really important that others can help us pick it up without feeling the brunt of it. And many years ago, I used to work for West Midlands Fire Brigade, very heavy in men. Men are obviously a lot more commonly employed at the fire brigade than women. But a lot of men were going to occupational health who were in their 40s, early 50s, really struggling with stress actually. And when some of the people in Occupational Health used to speak to them, they'd actually say there were lots of problems at home. And they said, "I don't know what's going on, but my wife, my partner's really changed. I go home, she's not interested in me, we don't talk, we just argue all night. She's sitting on the sofa, she's going to bed early, she's really miserable, she's not the person I married, I don't know whether it's me." And actually, once we gave education about what the menopause and perimenopause was, these men were quite relieved, because they say, "I still love my partner, but it's just not the person that I met before, not the person that I really chose to be with. They've completely transformed." So enabling people to understand what's going on meant that the conversation at home could start a lot earlier. And then often, and increasingly, I see people in my clinic who come with partners and want to be part of the journey. They want to be involved and listen to treatment choices. They want to really support and help their partner so that they can feel better sooner. And it has a massive positive relationship on their, or positive reaction really to everything around them as well. So involving partners is really good. But if you are suffering, actually talk to your partner and say, "Do you know what, this is really hard. I don't expect to be like this. I'm really struggling with my mood or my sleep or my joint pains, or I'm really struggling that my weight is changing and I don't know why. And is there any way you can help me? Or can we read something together? Or can we listen to a podcast together? Or do something so they're feeling included as well." And that is really, really important. I think also there's this whole conversation about children, and my children are very open, talk about everything. So there's no reason why they can't talk about hormones as well. And I think the sooner we draw them into the conversation, the better as well. They have hormones in their body, especially if they're teenagers. So they'll understand how hormones can affect us. But I think talking about how you're feeling is actually a really good thing to bring them into the conversation. You might be lucky and have a daughter like me who can help you make the diagnosis. But actually knowing that you're having some changes, that you're going to have some treatment, that the symptoms aren't going to last forever, is actually really reassuring for them as well, because a lot of children feel scared, especially when they hear parents shout or argue. So to know that it's not actually a relationship problem, it's more brought on because of the way you're feeling, because of your changing hormones, actually can be very reassuring for children to know. And children talk to each other, and actually my children have educated a lot of their friends' mothers, so they've gone round for supper, conversation about, oh, what does your mum do, talk about my work, and then they'll go, oh, I wonder if I'm having any menopausal symptoms. And then actually my children will often tell other people how safe hormones are, and no, the breast cancer risk isn't there for the newer types of HRT because they're body identical, they're natural, all they're doing is replacing hormones. And it makes the conversation easy. Children have a really good way of simplifying things. As we become adults, there's more noise in our heads, there's often more bias as to what we say, whereas young children explain things very simply. So seeing it through the eyes of children, the hormonal changes that occur, and how simple a lot of the conversation should be about HRT, about lifestyle choices, about what hormones do in our body, through the eyes of children can actually be very beneficial. So I've already said mood can have a massive impact. Some of the physical symptoms can have an impact, and I've seen a lot of people who have quite severe flushes and sweats, and they say, I don't even want to hold my partner's hand because as soon as I have contact with someone, I know it will a flush will occur, and then I certainly won't feel like anything intimate. It's really important when we think about intimacy and we think about sex, and I've spoken at sex before on one of the IG Lives when I was talking about genitourinary syndrome of the menopause. It's really important. There was an article I was reading in the paper yesterday, and they interviewed different couples, men, women, people who were in stable relationships, people who were single, people in same-sex relationships. And the common thread through it all was how people don't have sex anymore, how they still like their partners, or they still enjoy life, but they don't have as much sex as perhaps they would want to. And some people had actually written to say, it's just the way it is now. I realise that we're never going to have much sex, but I've resigned myself. It's sad, but that's the way. And I just was reading this and thinking, I wonder how many of these people are perimenopausal or menopausal, or the men have erectile dysfunction that hasn't been treated or addressed properly. It's very important to talk about sex because lots of people don't talk about it. It's hard to talk about money, and it's hard to talk about sex. We don't go out with our friends and talk about how much sex we have or we don't have. It's often quite a private thing. And so many women I speak to in my clinic say that they don't feel like sex anymore. They still love their husband, but they feel numb from the waist down. They say they just try and feign sleep when they go to bed and hope they're asleep before their partner comes in the bedroom. They're really scared of any intimacy. They don't feel that it's pleasurable when they have sex. There's no joy when they have sex at all. And it's just something that they feel they have to do to keep their relationship going. All these words make me feel really sad, actually. Sad that people aren't able to talk to their partner about how their libido's changed, but also sad that people aren't getting help, because there are treatments for reduced libido, and reduced libido in men and women is usually multifactorial, which means there's lots of reasons why people have reduced libido. Often it's there can be psychological reasons, there can be social reasons, but there can also be reasons related to hormones as well. So you might have the most wonderful partner, you might be the happiest person alive, you might not have any worries about anything else at all, you might really want to have sex, but there's no enjoyment or no pleasure, and you actually find that you're just not turned on in the same way, even though things are happening that in the past would have made a real difference. But we know our hormones have really important roles. Estradiol, progesterone, but especially testosterone can be very important for libido. And we know there's something called hypoactive sexual desire disorder, HSDD, which is very common actually. Between 10 and 25% of menopausal women will have it. Huge number of women will have HSDD, often not diagnosed. if you look at how it's diagnosed, it's a very long, complicated list of sort of criteria that people have to meet. But one of the things is people have to have been quite severely psychologically distressed with their low libido, and it has to have gone on for several months. Actually, I think that's quite barbaric. I think if people are having reduced libido that's affecting them, either themselves personally or with their relationship, then it's certainly a time to go and seek and have help. And as doctors, we're always holistic. We'll try and look at every single reason why people might have a symptom, including reduced libido. But if it's become more apparent when hormone levels have changed, then it probably is related to hormones, and we know we are allowed to prescribe testosterone. The guidelines are very clear. If women are on HRT and they have reduced libido, then we can consider testosterone. And often we give people what's called a therapeutic trial. We'll give testosterone because they have reduced libido and see if their libido improves. But many women who take HRT actually also find that their mood improves, their concentration improves, they're less irritable, they're happier, their sleep is better, they have less physical symptoms, so less joint pain. They often find that they can lose weight easier, their body shape changes, their confidence improves. So whether they're having sex or not, they just turn into a person, like I was saying at the beginning, who's happier, who's got more joy, who's more confident. And, excuse me, if you're with a partner and you're coming up to them and you don't mind being naked, you're going to maybe initiate a move, you're feeling more in control of your body, you know that you're going to sleep well that night, you know you've got more energy, you know that you feel better from within. Of course that's going to help your libido, and so all these things are really important. And so when we give HRT, we're not giving it usually for one symptom or two symptoms. We're looking at everything together. And then often once people feel better, then they eat better, they exercise more. And all these things really snowball to a more positive experience. The other thing to add, obviously, is if people are going to have sex, it's really important that they don't have any symptoms related to genitourinary syndrome of the menopause, which I've already said affects the vast majority, about 80% of menopausal women will have symptoms related to vaginal dryness, soreness, irritation, discomfort, and a lot of it can extend to penetrative sex, so people find that it can be very uncomfortable and painful. So even if their libido's there, they're feeling good about themselves, we often, or women often, then find that sex is really uncomfortable or painful. Or some women always have a urinary tract infection after intercourse, and so then are scared of having intercourse in case they then get a urinary tract infection. All of this can be related to the low hormones, especially estrogen and testosterone, in the vulva, vagina, urinary system, pelvic floor, all those surrounding tissues as well. And even if you're on HRT and all your other symptoms have improved, about 1 in 5, and I think probably more, but the studies say about 1 in 5 women still need vaginal hormones as well. And we know that those symptoms can come on with time. So people might have been on HRT for a few years and then find that a physical, intimate relationship is more uncomfortable or more painful, or they're getting some irritation, or the urinary tract infections, and in which case vaginal hormonal preparations, which I've spoken about before, can be really useful. So that's using vaginal tablets, vaginal pessaries, there's a vaginal gel, there's a vaginal cream, all can make a huge difference. And you have to try them for a good 3 to 4 months before noticing whether they make a difference. We've got the vaginal hormones, which contain just estrogen, or there's the one I've mentioned before, which is prasterone. In the UK it's called Intrarosa, and it contains DHEA, so it converts to both estradiol and testosterone and can be very, very beneficial. It's a daily pessary that I use increasingly for women, first line actually, so that can make a real difference. So I'm hoping that you can see there are all sorts of reasons why people's relationships can be affected during the perimenopause or menopause. But most of all, we just want to be loved and share love. Even this morning, I'm like I hope you realise, I take HRT, I feel fine, I don't have any hormonal imbalance. But this morning I got up early. There was no food in the house, there was no yoghurt, there was no fresh fruit to have my breakfast. I was waiting for the shops to open. I was really irritable. My children were all in bed. And I thought, what a great Mother's Day. So even I can be really irritable at times. But actually then I realised I was more hangry. I was hungry and angry. And then when my children got up, I gave them a short, sharp shrift. And that's really not good because the morning didn't start very well. But then actually as soon as I'd eaten and done my yoga practice, which my middle daughter Sophie joined me for, I just felt a completely different person. But I know myself, if I'm angry in the house, everyone just tiptoes round and gets really scared, and the whole atmosphere is awful. So it's actually often really important to internalise and think, what am I doing? I'm making everyone's life miserable here. It's not just me that's miserable. I'm transmitting my negativity to everyone else. And that's the same in life, isn't it? Whether we're negative at home, negative at work, negative on social media, it transmits out to others. So my one sort of key tip really on Mother's Day is try and be kind to yourself, try and be happy from within, and try and transmit those positive feelings to others. There's lots of positivity in the world. There's a huge amount of negativity as well. But actually we can only grow better and stronger if we focus on positive things and positive relationships. Any toxic relationships you have, or friends or family that are wearing you down, just concentrate on the good people in life, because that's what life is about, is making us all have good connections with the right people. So our relationships with our family are crucially important. Of course they are. Family should always come first, but our friends as well. And my daughter said something to me, my oldest daughter recently said, you know what, Mummy, friends are there for a reason, a season, or forever. And I think that's really crucial, because some of us get really worried when we don't stay in touch with friends, or the relationship might have petered out for various reasons. But actually, not all friends have to be lifelong, but we need to focus on those ones that are going to be lifelong. Really important. Same with work colleagues as well. And one of the things my grandmother said years ago to me is, Louise, treat others as you would want to be treated yourself. Now that can be quite hard during the perimenopause and menopause, or those days before your periods if you have PMS or PMDD. But try and internalise and think about your own emotions. Journaling can be really useful. Writing down how you feel and how you want to improve how you feel. Even little things. Just take some breaths before you open your mouth. Try and listen rather than just fire off, can be really useful. Mindfulness is really important. As many of you know, I do quite a lot of yoga, and actually just being focused on the mat is really important. And I sometimes, or I often meditate, but try and get any negative thoughts away. Don't allow them to come into your body. So try and radiate positivity. And my brother-in-law often says, reflect rather than absorb, which I think is really important when we're thinking about absorbing other people's emotions. You can absorb the good ones, but anything negative, try and reflect and just keep as positive as possible. So I hope that's been useful. Lots of tips there that I hope you can take forward with you. And I look forward to seeing you next weekend. I'll put this on my Instagram grid. If you've got any ideas for future topics, then please let me know. But we've got some lined up, so I'll announce next week's one next Sunday. So keep well, enjoy your evening, and have a good week ahead.